Here I'm going to show you how you have to read the question and how you practice the questions. Step 1, you can choose study button. Step 2, select category. You choose content area. And step 3, select subcategories. So it is good if you click not in the big box. It is good to click in the small triangle. Then subcategory come: antepartum, intrapartum, newborn, and postpartum. Here I'm going to show you antepartum care question answer. Total 173 questions. You can push in the begin session. The first question here. The nurse is preparing to teach a prenatal class about the fetal circulation. Which statement should be included in the teaching plan? So examiner asking this question, a prenatal class, right, before delivery, about the fetal circulations. Which statement should be included in the teaching plan? We select all that apply. So number 1, the ductus arteriosus allow blood to bypass the fetal lungs. So you should keep it in mind. The adult circulation and fetal circulation is not same. Okay, like this said, ductus arteriosus, right? It is very unique for the fetus. Okay, and it's play an important role in fetal circulation. And this is the structural part of fetal circulation, ductus arteriosus. Okay, and that allow the non-functioning lungs to receive only a minimal amount of oxygenated blood from the tissue. Tissue maintain their metabolism. So this is the one good choice, because ductus arteriosus allow the blood to bypass in fetal lungs. It is true about fetal circulation. One vein carry oxygenated blood from placenta to fetus. You see, one vein. Sometimes NCLEX board asks how many veins and how many arteries. Actually, it is one vein and two arteries. Right? So one vein carry oxygenated blood from placenta to fetus. It is true. We are learning here, right? New information. They said the normal fetal heart tone range 140 to 160 beat per minute in early pregnancies. So is it normal fetal heart rate? Definitely no, because the fetal heart rate is 110 to 160. 110 to 160. So it is not true. Then two artery. So one vein, two artery carry deoxygenated blood and waste product away from the fetus to placenta. Very true. One vein, two arteries. And last one, they said two veins. No, one vein, two arteries. So two veins, definitely it is not correct. So I do not need to read rest of the part, because two veins is not correct. Always one vein and two arteries in fetal circulation. So our answer is 1, 2, and 4. Can submit it. So why this is the answer? What are the rationale? What they say? So the ductus arteriosus is a unique fetal circulation structure that allow non-functioning lungs to receive only a minimal amount of oxygenated blood for tissue maintaining. Oxygenated blood is transported to the fetus by one umbilical vein. The normal fetal heart tone or heartbeat considered to be normal 110 to 160 beat per minute. Arteries carry deoxygenated blood and waste product from fetus, and umbilical vein carry oxygenated blood and provide oxygen and nutrient to the fetus. And blood pumped by the embryo's heart levels the embryo through the two umbilical arteries. It is very informative about the fetal circulations. Next question here. Here they said nursing instructor asked the student to describe the fetal circulations, specifically the ductus venosus, which statement by the student indicate an understanding of the ductus arteriosus. So ductus arteriosus is a part of fetal circulation as well, right? And ductus venosus connect the umbilical vein to the inferior vena cava. So they said which statement by the student indicate understanding the fetal circulation about ductus arteriosus. So number one, it connect the pulmonary artery to the aorta, right? So it is not true because ductus venosus connect umbilical vein to the inferior vena cava. Number two, it is the opening between right and left artery. No. It connects the umbilical vein to the inferior vena cava. So this is the information we learn. Ductus arteriosus connect umbilical vein to the inferior vena cava. Number four, it connect umbilical artery. No, it is umbilical vein. So we chose number three. Submit. Rationale. They said ductus venosus connect umbilical vein, inferior vena cava. The foramen ovale is a temporary opening between the right and left pulmonary arteries. So next questions here. A pregnant client tells the client nurse that she wants to know the sex of her baby as soon as it can be determined. So few parents have very curiosity about the sex of the baby. So like this parents, the nurse informed the client that she should be able to find out the sex at 12 weeks of gestation because of what factor, right? So if we go and check by ultrasound, we can easily determine or find out the genitalia. But it is important, it should be mature around, 12 weeks. right? So examine asking around 12 weeks of gestation because of what factors? Number one, appearance of the fetal external genitalia, right? So you can see in the ultrasound or Doppler. Number two, beginning of differentiation of fetal growing. No, it is external genitalia. Fetal testes and descent into the scrotal sac. So it number three is not correct because if it is female, then why about the testes? The internal differentiation in male and female become appearance. Internal, but we need external appearance of the external genitalia. So it can easily to find it out in the diagnostic test. So they say rationale. By the end of the 12 weeks, the external genitalia of the fetus have developed to such a degree that sex of the fetus can determined visually, and differentiation of the external genitalia occur at the end of the 9th weeks. Testes descend into the scrotal sac at the end of 30 to 18 weeks, 13 to 18 weeks. Internal differentiation, male and female, occur at the end of 7th week, but it not help you to find out the fetal sex. The next question we can say from here, the nurse is performed and assessment on a client who is at 38 weeks gestation, and note that the fetal heart rate is 174 beat per minute. On the basis of the findings, what are the priorities of nursing action? So 38 weeks gestation and fetal heart rate 174, right? Because it is important, every student must know the fetal heart rate depends on gestational age, right? So 38 weeks, is it normal or abnormal, right? And at the 38 weeks, it's supposed to be 110 to 160 beat per minute around 38 weeks. So it is not normal. So when you found like this 4 option, what you could do? Document the findings. Yes, we will document it, but not now at the ending. Check the mother's heart rate. You can do it, but it is not the priorities. Number 4, notify healthcare provider. Number 3 is a good choice. Notify the healthcare provider. Then go check mother 1, then keep the documentation. Number 4, tell the client that fetal rate is abnormal or no. Number 4 does not make sense. So number 3 is best choice. You notify healthcare provider, check the mother heart, and keep the document, right? Submit and rationale. The fetal heart rate depends on gestational age and range from 160 to 170 beat per minute in the first trimester, but shows with the fetal growth when they are going bigger and bigger, then it should be 110 to 60 beat near at the term. It is in the examiner talking 38 weeks. So it is almost near at term. At or near term, if the fetal heart rate less than 110 beat per minute or more than 160 beat per minute within the uterus at the rest, the fetus may be in distress because the fetal heart rate is increased from reference range. The nurse should notify the healthcare provider. So what is the next questions? Here, the nurse is conducting a prenatal class on the female reproductive system. When a client in the class asks why fertilization ovum stay in the fallopian tube for 3 days, and what are the nurse best response? So, you know, when a couple want a baby, after the coitus, the sperm is moved into the female genital organ, then it's go to the uterus, then go fallopian tube to meet with the queen, and queen is the ovum. Ovary secreted ovum, and ovum is fertilized by the successful sperm, and they united and make a zygote. But 3 days, the zygote supposed to stay or be in the fallopian tube. After 3 days, it will be implanted in the uterus to continue the pregnancies. If they continue in the fallopian tube, we're supposed to call ectopic pregnancies. And ectopic pregnancy is the medical emergencies. So examiner asking why the fertilized ova or zygote have to stay in the fallopian tube for 3 days, right? Why after 3 days they will come to the body of the fundus or cavity of the uterus? What are the best response? Number one, it promotes fertilized ova change for survival. Number two, it promotes the fertilized ova exposed to estrogen and progesterone. Number three, it promotes fertilized ova normal implantation in the top portion of uterus. So this zygote need to preparation. They concentrate, they united, and then they go inside the or implantation occur fundus of the uterus, right? They need some preparation, and it is the normal physiology. They promote the fertilized ova's normal implantation in the top portion of fundus. So the good choice is this. It promotes the fertilized ova exposed to luteinizing hormone. It is not true, right? So why number three? What are the rationale? The tubal ischemic remain the contracted until the 3 days after conceptions to allow the fertilized ova to develop within the tube. And this initial growth of the fertilized ova promote its normal implantations in the fundal portion of the uterus corpus. Estrogen is a hormone produced by ovarian follicles and corpus luteum or adrenal cortex and placental during the pregnancy. And also progesterone is a hormone secreted at the corpus luteum of the ovary, and also adrenal glands and placenta during pregnancy. And luteinizing hormones and follicles stimulating hormones are excreted by the anterior pituitary glands. They said the survival of fertilized ova does not depend on it staying in the fallopian tube or not. The next question here we go and see. And this question about the select all. That's nursing instruction asked a nursing student to explain the characteristics of amniotic fluid, right? So amniotic fluid protect our baby. It acts as a shock absorber, right? It protect from any kind of infection to get in the baby. The student response correctly explain which of the characteristics of amniotic fluid. Select all. So you have to know the basic character function of amniotic fluid. Then you can answer the questions. And amniotic fluid surround your baby. They act as a cushion, protect our baby, right? So number one, allow the fetal movement. Yes, very good choice. It is the fluid baby can move inside. Number two, sound. It acts as a sound surroundings, cushions, and protect the fetus. Wonderful choice. Now, maintain the body temperature of the fetus. Yes, it is true. The fluid maintain the fetus body temperature. Number four, can be used to measure fetal kidney function. Yes, this fluid can contain the waste product. If you want, you can check and get the serum creatinine level. It indicates the baby's kidney, how functioning. Number five, they said, prevent the large particles such as bacteria from passing to the fetus. Basically, amniotic fluid does not any rules to prevent the large particles such as bacteria. Does not have any rules. And number six, provide exchange the nutrient fluid. No, umbilical cord helps to nutrient exchange the nutrient food or waste product, not the amniotic fluid. So it is not a choice. So what is their rationales? What they say? The amniotic fluid surrounds or amniotic fluid acts as a cushion and protect the fetus. It allows the fetus to move freely and maintain the body temperature of the fetus. In additions, the amniotic fluid contains urine from the fetus and can be used to assess the fetal kidney function if need. The placenta prevents large particles such as bacteria from passing to the fetus and provide exchange and nutrient and waste product between mother and fetus. Let me go the next questions. Here, a couple come to the family planning clinic and asks about the sterilization procedure, right? Which questions by the nurse should determine whether this method of family planning would be the best options. So examine asking a couple come, how you determined the sterilization is a best option. What question we could ask, right? Because sterilization process is a method of contraceptions. So number one, did you ever had surgery? So which is the best question? So number one, did you have surgery? It doesn't make any sense. If you have surgery, you can do this. And it does not related to the sterilization procedure. Number two, do you plan to have any other children? It is very good questions. Because after sterilization procedure, if you want to continue the pregnancy, it is not possible because it is the permanent procedure. You have to make sure how many baby they have, or they have a desire to take another baby. So it is a very good questions to ask for this. Do either of you have diabetes mellitus? It is not important for sterilizations. Do either of you have a problem with high blood pressure? Same thing, no relation with that sterilization. Only one option, number two. So why? Number two is the question answer. Rational said sterilization is a method of conception for the couple who have completed their families. So we have to make sure they have at least 2 babies and they do not have any plan to take baby in future. It should be considered a permanent end of fertility because of reversal surgery is not always successful. The nurse would ask the couple about their plans for having children in the futures. And what are the next question? The nurse should make which statement to a pregnant client found to have a gynecoid pelvis, right? So this question asking about the size and shape of pelvis. There's several types of pelvis, right? Female pelvis type. So they said which statement of the pregnant client found to have a gynecoid pelvis. Number one, you type of pelvis have a narrow pelvic bones or arch. Number two, you type of pelvis is the most favorable for labor and birth. As I told you, there are several types of pelvis, but most favorable for the successful labor pelvis is called gynecoid pelvis. Okay. So this is very relevant. You type of pelvis is the most favorable for the labor. Number two is a good answer. You type of pelvis is a wide pelvis, but it is short diameter. No, it is wide. Diameter is good for labor and birth. Number four, you will need a C-section or cesarean sections because this type of pelvis, no, it is wrong because I said it is most favorable. Why? This is the answer. A gynecoid pelvis is the normal female pelvis and the most favorable for successful labor and birth. An android type would be unfavorable for labor because of narrow pelvis plane. And anthropoid pelvis has an outlet that is adequate with a normal or moderately narrow pelvic arch, right? So what we need to learn? We need to learn what are the normal favorable type of pelvis. This is gynecoid pelvis. Why it is most favorable? Because it is good for the delivery. Next question. Which of the following, which purpose of placental functioning should the nurse include in a prenatal classes? So purpose of placental functioning should the nurse include prenatal class. Select all, right? So the placenta provide so many roles and functions. This question about this, it cushion and protect the baby. It does not work as a cushion. Amniotic fluid work it, right? It maintain temperature. Amniotic fluid maintain temperature. It is the way baby get food and oxygen or nutrient from mother. Yes, right? And number four, it is prevent antibodies and viruses from passing to the baby. So placenta does not work. Umbilical cord work it is. Number five, it provides exchange of nutrient and waste product between mother and developing fetus. Yes, it is true. Why? The placenta provide an exchange of oxygen, provide nutrient and waste product between the mother and fetus. The amniotic fluid surround the baby, act as a cushion, protect the fetus, and maintain the body temperature of the fetus. Nutrient, medications, antibiotics, and viruses can pass through the placenta. The next question here. The nurse is providing instructions to a pregnant client who is scheduled for a amniocentesis. So amniocentesis is a diagnostic procedure. We collect the amniotic fluid for genetic testing. If parents have a strong family history of congenital disease, if mother or parents have a curiosity to know their baby will be disease-free, we collect the fluid through the amniocentesis procedure. So amniocentesis procedure have some side effect, right? So it is good to avoid. So what instruction should the nurse provide if parents have a plan for amniocentesis? Because amniocentesis is an invasive procedure. Number one, strict bed rest is required after the procedure. Number two, hospitalization is necessary for 24 hours after the procedure. Number three, an informed consent need to be signed both before the procedure. So this is nurse provide instruction the pregnant client who is scheduled for amniocentesis. What instruction should the nurse provide? Nurse should be explain the procedure, then take the informed consent from the mother before the procedure. right? Very important. So number 3, which is the best choice. A fever is expected after the procedure, maybe or may not, but this is the priorities. So why it is? Let me explain a little bit more about the amniocentesis. Because amniocentesis is an invasive procedure and informed consent need to be obtained before the procedure. After the procedure, the client is instructed to rest, but maybe resume light activity after cramping subside. So when pain is disappear, they can do light activities. The client is instructed to keep the uh, punctured site clean and report any complications such as chill, fever, bleeding, or leakage of fluid at the needle insertion site. This is the danger site, danger sign. Also, if decrease the fetal movement or uterine contractions or cramping. So it is the danger sign. Always we have to inform healthcare provider. Amniocentesis is a outpatient procedure and may be done in the healthcare provider office or in a special prenatal testing site. Hospitalization is not necessary.